I watched this video recently, a couple weeks ago, so I will be pretty heavily paraphrasing, but there are a couple of things that really stuck out to me. So if you're not familiar, this is a person who is a licensed clinical psychologist, and she also has a book talking about how as a child she was diagnosed as a sociopath. And I recommend anybody watch it just because it's interesting. I think it's a much more balanced approach to psychopathy or being a sociopath. Obviously, it's not a DSM criteria that we can diagnose someone with, but it's like a series of callous unemotional traits, right? Typically. And I think my favorite part of the video, and I think it's so relevant to like TikTok and TikTok therapists and like discourse around mental health, was how she talked about therapists and how to be a psychologist without having empathy, because that's kind of the whole point, right? If you're a psychopath or a sociopath, you don't really have empathy the way that a traditional person might have empathy. And so she talked about like, okay, so people ask her, how are you a psychologist? How are you a therapist if you don't feel emotions the same way that other people do? And she had such a great response where it's like, this is my job. This is what I'm trained in. My training is in intervention and ways to help you navigate the challenges you're facing. I don't have to feel what you're feeling to be helpful. And I think that's such a unique and kind of refreshing way of looking at it, because I see a lot of discourse of like, therapists, like, we're not doing it for the money. And like, honestly, we're not, because if we were doing it for the money, we'd be probably investment bankers. I don't know. But at the same time, it's a job. Like, I went through a decade of specialized training and schooling to do what I do. And in no way is every day like a day where I'm like, woohoo, I am the best therapist. I love everyone and I'm so empathetic. What gets me through those days is that I am a professional. I am trained as a professional. And my skill set does not rely on how I am feeling that day. And honestly, I think I would really like a therapist or a psychologist as well who is able to differentiate them as a person versus as a professional. And we don't need to be mushy-gushy. I think a lot of people are surprised to meet me and some of my colleagues, and like, we're not touchy-feely necessarily. We're pretty in tune with our emotions, like we know how to label, but we are also intellectualizers like a lot of y'all. And some days we're just people and we kind of want to be a-holes. And so I found this interview to be so refreshing and such a great way of putting the reality of being a human being in a profession where we're supposed to just always care about other people. And obviously we do. We wouldn't do this if we didn't. But she makes such a great point about like, you can still be very good as a provider even without having that. I don't know. Let me know your thoughts.